Dr. Cynthia Hatton. It's amazing how we met. I don't even remember how you and I connected. Do you remember?
I do. I have been searching for a place to land to treat infants. And actually, I was looking for a yoga class. And your Flower of Life Foundation came up.
We have a lot of the same similar paths, just things that we have explored through education, like with pre and perinatal psychology and craniosacral therapy, and obviously holistic medicine. Maybe you can tell us a little bit about your path and what your training is and what brought you to work with babies.
Sure. So I've been a chiropractor for about 28 years, and I've treated a whole range of ages. And then as the years went by, I wanted to really hone that down to children. And then after treating some newborns, I found that's where I really want my focus to be because babies, when they're newborn and they come home, they have issues, either crying or difficulty latching or torticollis and that's all due to a normal birth. And with craniosacral therapy, that can be helped along very quickly. And so for my goal is to have peace reign in the family when the newborns come home.
Yes, and it's funny because so few people, a lot of chiropractors you see nowadays will work with babies, but it's not very common actually that you see people working in the realm of just the difficulties that arise with having a baby in the office, with the
Right,
crying and children in general, because it's hard for them to sit still. And
right.
they're not always the easiest patients to work with. So I think it's a niche that is underserved.
I do too. And especially with the craniosacral therapy, which is a very light touch. It's physical, but it's also energetic, releasing of the cranial bones, which then releases the tension in the spinal cord and creates slack so that, you know, the baby can relax. So basically, I treat the birth.
Yeah, and so few people also they're never educated, not by their doctor, certainly,
No,
that the birth does cause so many issues, and very rarely do you have a doctor anymore that actually delivers naturally.
yeah,
I've spoken to many OBGYNs and they don't even learn really about natural birth in medical school. It's about interventions and managing the interventions. That's prominently what. So when you're talking about you treat a normal birth, most people that give birth today haven't gone through a
no.
normal birth. They have stacked on many interventions. And just for those listening, what is an intervention? Do you have categories that you understand to be interventions?
Cesarean, of course, is
Yes.
one, but leading up to that is in inducing labor. So the meds they use for that can
Yes.
cause issues,
Yes.
baby and mom.
And I see that all the time with especially children with ADHD or anxiety, or they've got a hyped up nervous system. And a
Mm,
lot of people don't realize that induction creates a synthetic environment that compresses the nervous system.
right.
If it compresses the nervous system, it's going to compress the tissues. And as we all say, like the issues are in the tissues.
Right.
So when you work with a baby from such an early age, do you find that they are the remedy is pretty quick, or do you think it takes a lot of work?
It depends. Typically, torticollis takes a little longer because it's more structural. They're stuck, their neck is stuck in one place. But reflux is a pretty fast remedy. And it all depends on the baby.
Yeah. And the
And
story that the baby's carrying in the family field.
Right.
Because we always, when I do intakes with my families, I want to know how the mother was born. I also want to know what's the history that the mother and the caretakers have been through, because that explains a lot about the autonomic nervous system that the family is carrying. And that baby is a mirror of a
Exactly.
hitchhiker on the autonomic nervous system of the parents.
Right.
It does give a lot of the information that we need to understand how to work with the baby, because babies don't come alone.
Right. Yes. So,
Yeah. Hey, what do you see as the need? That's what I'm curious. Like, what do you see as the need for the services that you offer?
you mean, so what would I treat?
Or just how do your services benefit society
Okay.
in a
Well,
larger picture?
right. Larger picture, I'll hone in on the home first. When parents bring a newborn home, it's different. It's changed their whole life.
Yeah.
And if the baby is having trouble, it makes that transition difficult. Even if they've had children before, it still makes that transition difficult. So being able to go through that change with less stress is really important,
Yeah.
not just for baby, but for parents and any other siblings.
I believe Dr. David Chamberlain was the one who coined the phrase, like, as the tree is bent, so the tree grows. So if we can really resolve a lot of these problems in the very get-go, it's such a happier life.
Some issues, if it's not like the cranial bones, if they're not aligned beyond a certain age, then yes, that can lead to difficulty concentrating.
Yeah.
You
No, it
know,
has all kinds of implications on the vagus nerve and
right,
the cranial
exactly.
nerves that, are influencing your behavior, your emotions, how
Mm.
you view the world. It's really interesting how it's all tied together.
It is, yeah. And most doctors don't even know that piece.
Yeah.
Not even all chiropractors.
Very true. I really wanted to have these few minutes with you just to give people a taste of who you are so they could see you
Ah.
live in person. And we really encourage those who are interested to reach out. We've got the button here on the webpage where it's like you can book a free consultation with Dr. Cynthia. And we look forward to hearing from people. So thanks for
Me
your time.
too. Yes, I look forward to meeting new babies and mamas and daddies.
And thank you.
Thank you.